Hi, I'm Corey Wolf. I'm an associate professor at New York Institute of Technology. Julia, a 35-year-old Hispanic female, reported that blood work done for a life insurance physical indicated she was pre-diabetic due to her hemoglobin A1C being 5.9%. At that point, she had not seen a healthcare provider in 5 years. After an initial visit, it was determined that Julia is overweight and may have prediabetes. Julia agreed to several additional tests and to return in a week to discuss the results. Julia returns a week after doing fasting blood work. She feels well and has no complaints. Her lipid panel indicates that her HDLs are low, but her LDLs, triglycerides, and total cholesterol are within the normal range, as are her liver function and thyroid function tests. Her fasting glucose is 121 milligrams per deciliter, and her hemoglobin A1C was 5.9%, both of which confirm that she has prediabetes. To recap, Julia is overweight, has prediabetes, and low HDLs. Being overweight can promote hyperglycemia and diabetes is a major risk factor for cardiovascular disease. Motivational interviewing is a psychotherapeutic technique developed to help patients move away from a state of indecision or uncertainty and find the motivation to make positive decisions and achieve established goals. There are 5 main principles: express empathy through reflective listening, develop discrepancy between clients' goals or values and their current behavior, avoid argument and direct confrontation, adjust to client resistance rather than opposing it directly, support self-efficacy and optimism. Although external influences incite inspiration, only a patient's intrinsic strengths can create sustainable motivation. The 5 components of motivational interviewing include pre-contemplation, contemplation, preparation, action, and maintenance. The role of the provider is to understand each stage and provide patients compassion and guidance along the way. You must gauge the patient's level of commitment and aid in acknowledging responsibilities, readiness, and the steps taken to execute each goal. Empower patients by echoing their internal conversations and analyze deep-rooted ambitions. Some motivational interviewing tips include gaining trust, which is crucial when securing key information, asking open-ended questions, which helps information flow, but most importantly, clinicians must be aware of personal biases, not if you have them, but what are they? What can Julia do to improve her HDLs and blood glucose, as well as decrease her risk of developing diabetes and cardiovascular disease? She can eat healthy foods, be more active, lose excess weight, and stop smoking. While it is well known that smoking can cause COPD and lung cancer, patients and providers should also recognize it may increase the risk of developing type 2 diabetes. Choose foods low in fat and calories and high in fiber. Focus on fruits, vegetables, and whole grains. There's no best diet, and there's a wide variety of choices. Some examples are the Mediterranean diet, therapeutic lifestyle diet, DASH, ketogenic diet, Ornish diet, vegetarianism, intermittent fasting, and commercial diet programs. While some have diet in their name, try not to consider it a diet and think of it as more of a lifestyle. Keeping a journal for reflection is of great importance when embarking on this journey. Aim for at least 150 minutes of moderate intensity aerobic physical activity or 75 minutes of vigorous intensity physical activity or an equivalent combination each week. Routine physical activity may improve body composition, body processes such as endocrine and immune abnormalities, metabolic, musculoskeletal, cardiovascular, pulmonary, mental, sexual, and cognitive health. Use a pedometer, limit TV and computer time. Most importantly, decrease sedentary time. Can we discuss your weight? Always ask a patient for permission to discuss their weight. If a patient says no, then they're not ready and you must respect that. If yes, then you have an opening to start the conversation. Set realistic goals. Unrealistic goals set a patient up for disappointment and failure. A realistic goal is losing 1 to 2 pounds a week. Losing just 5 to 7% of excess body weight can reduce the risk of type 2 diabetes. A daily caloric deficit of 500 calories a day will promote a 1 pound a week weight loss. 500 calories equals 2 sugary beverages or 2 candy bars. Regardless of patient history, tobacco use should be addressed at every visit. This can be accomplished by using the 5 A's. Ask. Identify and document tobacco status for every patient at every visit. Advise. In a clear, strong, and personalized manner, urge every tobacco user to quit. Assess. Is the tobacco user willing to make a quit attempt at this time? Assist. For the patients willing to make a quit attempt, use counseling and pharmacotherapy to help them quit. Arrange. Schedule follow-up contact in person or by telephone, preferably within the first week after the quit date. Behavioral skills that should be cultivated in people engaged in a weight management program include self-monitoring, stimulus control, problem solving, goal setting, and relapse prevention. Journaling is very helpful in identifying and modifying behaviors.